Welcome to a special edition of the Bioethics Channel as we focus on healthcare reform moving forward following the U.S. Supreme Court ruling upholding the Affordable Care Act. Joining us on the program is Art Caplan, Director of Medical Ethics at New York University. Dr. Caplan, you've written that the Supreme Court ruling on health reform is ethically very good news. Tell us why you think that is so.
Well, I think it's good news because the greatest moral failure of American healthcare is that it has such a large number of people without minimal health insurance. You've got to bring those people in for a variety of reasons, some of them ethical, some of them in terms of cost, but basically leaving a bunch of people uninsured and giving them care makes the rest of us pay for it, lets people be free riders or free loaders without calling them to account, and leaves too many people who are just utterly vulnerable, can't figure out how to navigate the system without coverage. So getting everybody into the system is the first step, I think, in having an ethical healthcare system.
So the program we have right now isn't working, but at least this is a start moving down the road towards what you're talking about.
I think it's only a start, but it's a big start, and it's where I think we should start. So the first challenge is get everybody in. Then we have to move on to what are we giving them? You know, there hasn't been a lot of discussion in health reform about what benefits are covered. There's some stuff in the thousands of pages of the plan that talks about covering prevention and more preventative and diagnostic things than have been covered in the past. That's nice. But some tough questions about what benefits specifically do you get or don't you get, what drugs, what particular expensive things aren't really being discussed. And we're going to face a challenge, obviously, about how to pay for this and cover the cost. But I think getting everybody into the system is a big, big step and should be step number one.
I'm trying to recall a comment that you made after passage of the bill back in 2010, something to the extent of that everyone should not expect everything when it comes to health care, even with the passage of the bill. Do I have that right?
Yeah, you do. And look, we have a lot of drugs coming available now that might give you 2 months of life for $100,000. We have some pills like Provenge and Herceptin. These are things that fight cancer, but they're just not very effective. We've got some other things for treatments like Gaucher's disease that cost $500,000 a year. I don't see how we're going to cover that kind of thing for everybody. I think when I talk about bringing everybody into the system, it's for basic health insurance. What we're probably going to see for some of this marginal, innovative, even new and experimental stuff is copays. And somebody might say, but wait a minute, that's not fair. It's the two-class system. You're going to have the rich with better access than the poor. Yes, you are. I think that's a reality. But the poor right now have such poor access basically through emergency departments that it's indescribably bad, and the insured are doing much, much better. So I think we'll get the minimal level of coverage to be better and bring everybody to that. But I still think you're going to see some disparities in terms of who gets what in American healthcare.
Now the debate moves from the Supreme Court, where we generally know the rules, to the political and electoral arena, where we really have no rules at all. Are we making progress or not as we move forward and try to meet the challenges of actually keeping this going?
Well, partly. We are having a debate, it seems to never end, about whether or not this Obama plan is a good idea, fair and just, or some kind of government tyranny socializing our healthcare system. Now, to some extent, I think that debate with the enactment of the law and the Supreme Court upholding it should end, but I understand that opponents may still say, look, you can still overturn things legislatively. There's nothing is beyond debate or discussion or even repeal. So fair enough, and we're having that debate. I don't think we're having that debate in a way that makes a whole lot of sense. Telling people that they have to buy health care insurance seems to me to be absolutely the right way to go. I know there's been criticism on the Republican side of the mandate. The Supreme Court kind of upheld the mandate, but morally the mandate makes a lot of sense because you don't want people in the system who are uninsured, bringing up the cost of health care for the rest of us. So unless you're prepared to say we got 30 million uninsured people, and if they get hit by a bus, they can die in the street because we're not going to give them any care, as long as you're going to bring them to the ER or give them some kind of care, then we have to pay for it. It's very similar to automobile insurance. If there are a lot of uninsured drivers around, then we wind up getting stuck with a bill for the damage they cause to other cars and other people. That's why we mandate that they have to have some minimal automobile insurance to go out on the road. Healthcare is very similar. You're not going to fail to treat people. You don't want freeloaders. You don't want people gaming the system to escape the cost. So you try to mandate that they have to pay.
What about the arguments that you've been making in print about a moral case and making the moral case for healthcare reform?
I've been a little disappointed with the Obama administration, the president himself, that they haven't really sold the ethics of this health reform to the American people effectively. They've said it's cheaper to go this way. It's a way to rein in cost. Prevention will be better than trying to treat disease, better to get people out of the ERs and down to primary care providers as a more efficient way to go. But that's money talk. And I think what sells this plan is moral talk. And I think there are three reasons morally why health reform is important. The first one is you got too many people who can't navigate the system who don't have any insurance. They're either mentally impaired or they're children, they're illiterate, and they're just not going to be able to make choices, figure out what to do. There's also in that group a lot of unemployed folks who've lost their insurance because the economy is so bad. So you've got to pick them up. And those are kind of protecting a vulnerable population. Secondly, I'd like to hear defenders of the plan say, we believe in equality of opportunity in America. That's an American value. If you don't have access to health insurance, you don't get health care, you don't have equality of opportunity. You can't compete if you can't see, can't walk, can't chew, can't eat. And I think our commitment to this notion of everybody in isn't because we love our neighbors or we're kind of socially committed to solidarity. That's true in other countries as their values, but ours is opportunity. And I think that's the one that would sell it to the American people. They know what it means for education. I think they'd get it in healthcare. And lastly, you don't like free riders and people who are freeloaders. And if you have in that uninsured group college kids at 26 who are saying, I'm not getting health insurance, I'm healthy, I don't need it. Well, they may need it, and they should pay something for it, and they're going to need it at some point in their lives, so they ought to be paying something for it when they're younger. We can argue about how much, we can argue about how much coverage they need, but this notion of being a kind of a cheat in the healthcare system ought to come to an end. So I think there are some powerful moral reasons for health reform. We just haven't heard them, I think, loudly enough.
Well, speaking of loud, we're in the middle of an election season, and is making the moral case even possible during an election as polarizing as this one is and will be between now and November 2012?
I think it is. I think you'll do better with the moral case than you will with trying to get down in the weeds and the details. Nobody cares about that except a bunch of academics and a few policy wonks. The 2,000-page plan is not going to get read by anybody likely to be in a voting booth. It just isn't. So you've got to sell this basically on a one-page set of principles, on an argument you could boil down to a single sheet of paper. I think the ethics does that, and I think the critics know that because they're in there saying government coercion, government takeover, mandating your behavior, forcing you to buy something that you don't want to. Those are ethics arguments. They're not arguing back and forth about whether Section 509 of the bill that requires coverage of genetic tests is good or bad.
Well, it seems like, Art, that we've been moving back and forth on a spectrum for a long time on this issue, with one side market-driven healthcare where we have winners and losers, and I think a lot of people are uncomfortable with that. And then on the other side of the spectrum, you have government healthcare where we have a discomfort over government being in charge, so to speak. Are we getting closer to identifying, I guess, what you would call a sweet spot, that moral place where we need to be on that spectrum?
I think we are, because on the Obama plan, you're basically trying to extend health insurance by either giving them a mandate to buy it or a voucher to buy it or throwing them into the state's Medicaid program for coverage. But you're not eliminating private providers. No one's doing away with hospitals or managed care companies. No one's, in fact, doing away with insurance companies being able to offer these basic plans or offer better ones for that matter. So the compromise, if you will, is we still have a private healthcare system. We're just trying to make sure that everybody pays something to get into it. And by the way, that's why we're not hearing big opposition from pharmaceutical companies, biotech companies, insurance companies, some of the people who might be most likely to support the Republican criticisms are quiet. We haven't heard from them. There's no Harry and Louise ad this time around. Why is that? Well, it's because insurers, providers, and manufacturers of healthcare products like it if they think that there's going to be more people who can buy their products and pay for their products. So they're not opposed to this. They don't see it as socialized medicine. They see it as bringing more income into their coffers through volume, and they may get cut a little bit on price or a little bit on coverage, but they can make it up on volume. And so the private sector really is pretty happy, and that's a kind of a compromise.
Art Caplan is Director of Medical Ethics at New York University. I'm Lorell LaBoube. Thanks for listening to the Bioethics Channel.